Alright, what's up, people? I am sitting, I just had surgery on my nose. I'm waiting for Sherell to come pick me up in the wheelchair. My deviated septum is fixed. My enlarged tubinates are reduced. I actually feel good. There's no packing in there. But I'm going to give you guys day-by-day recovery updates. And we'll go from there. Let's do this, people. Alright, so I'm going to keep giving you guys updates. I've been home for about 3 hours now. It's not too bad. Little leakage, that's why this little guy's here to keep catching any blood that drains out. I was able to eat, take my medicine. I'm in no pain though. There's no packing. There's no nasal splints, which when doing research, that seems like what really is the pain in the ass that really hurts and makes life uncomfortable, but I don't have any of that in there. It's just really just open. I gotta put some Neosporin or Bacitration at the tip of my nose. Sherell went and got this nasal spray that they told her to get. I got to use Afrin, which is like a steroid nasal spray for if the bleeding continues, just to help with that. But as long as I keep my head back, I don't really have any too much drainage, so I've been laying down. And today, day one, seems to be pretty straightforward, and go from there. But keep you guys posted. So I guess in surgical terms, this is considered day one, but it is the next day. So far, no real pain. It's been pretty smooth for the most part. Only thing is now that stuffiness and congestion that the doctor was talking about going to happen is in full swing, so I can't really breathe through my nose very well. It doesn't hurt. It's more so just like having a really bad cold. You can sniffle a little bit. You can't blow your nose. I put Neosporin inside of my nose in order to kind of make sure the crustiness of the scabbing doesn't get too hard. So I have that going on there. I was able to do the tip last night, but today I'm actually able to go a little bit further in to do it. It's not really actively bleeding. And that's why it's shiny now because of the Neosporin. But I'm not actually actively bleeding. It's just more so the stuffiness now, so which is good. So I'm still taking a pain med, so I don't know if that's helping or not. But I haven't gotten to the point where it's like I really needed to reach for it. It's just like I've just been taking it like clockwork just to be on the safe side, and it's been good. Remember, I didn't have any type of packing or nasal splints in my nose, so if you are going to get this done, research your doctor to find out how they plan on doing it, what procedure they use. There are some doctors that still use nasal splits because of tradition, so keep that in mind. And that's what I heard really sucks the most, is having to get those taken out. So we'll see. But so far, day two, we're alright. There's no real swelling. That's the size my nose always looks like. As you can tell, I'm probably bad nasally. But we just take it one day at a time and figure it out from there. Just been laying down, eating perfectly fine. I used a little bit of Afrin last night so I could go to sleep because I couldn't sleep. I was up until like maybe 6 o'clock in the morning because of the stuffiness. Well, I sprayed a little Afrin. It didn't help, but at least I didn't feel like there was constantly stuff dripping behind my throat. So that helped a little bit, and we'll go from there. But until now, I'm just going to see if I could keep putting the Bacitration in there, keep it nice and moist. Tomorrow, I'm going to start with the saline spray to start spraying it out. I'm not going to use a neti pot. The guy said don't worry about using a neti pot. The saline spray should work fine, flushing things out. I go back on Thursday, which is exactly 7 days after my surgery, and he's going to say he's going to suction out whatever's in there, kind of check it out for my post-op surgery. So I give us some time for that. My biggest goal is just to try to keep it as clean and moist as possible until then, so that when he does get there, he doesn't tell me the word that I'm going to experience discomfort while he's about to do what he's doing because of how it looks. So that's the goal. Because discomfort, in doctor's terms, means it's going to hurt like hell, more than likely. So, we'll see what it does. I have disposable stitches. I haven't seen any of them pop out yet or anything like that. So, we'll keep it going. Alright, it's Friday night. Had my surgery Wednesday. I'm doing a lot better today. A little congested earlier, but I was able to use the saline rinse out today a couple times. That helped. Also did a couple sprays of Afrin in there to kind of help open up. So I'm breathing through both noses for the first time. Usually just one at a time, but it's not lasting very long. I can feel that it's closing back up already, but it's working. I don't really feel too much pain. I've been sleeping on and off for the past 2 days. More like, not really pain, but like pressure right here. More than anything else. So, but not really like excruciating pain. More like I could feel like, kind of like a headache. I guess if you've ever had any type of like sinus issues in the past, and like a sinus headache, you might understand what that feels like. But it's not too bad, to be honest with you. You know, when I did the nasal mist, I thought a lot more stuff was going to come out. It's really just kind of like the saline solution with a tint of redness in it. That's really just all that's coming. No chunks of anything or anything like that. I keep the tips of my nose moist with Bacitration and Neosporin, whichever one I'm using, and I'm just doing it. Hardest thing is because you breathe through your mouth so much, your lips just get dry. That sucks. But yeah, so no real active drainage, so I don't have to think on my nose. I'm probably still going to sleep with it just to be on the safe side. But so far so good. It's, this is technically day 2, because surgery day is technically day 0. So can't really complain too much. I'm still taking the pain medicine like clockwork just to be on the safe side. Yesterday I took it a little later, and I did start to feel it like at the tip of my nose. It felt like kind of like a pulling action. So I realized that I forgot to take the medicine, but I've been taking it like clockwork. So I can't really say if it's too painful, but it's not too bad, to be honest with you, man. I'll just say this: just be prepared to be able to be laid up for a little while, have a little help, just so you can kind of sleep in peace type deal, and good to go from there. And it's alright, so I'll kind of keep you guys posted, see what's going on, but I should be good to go, ready for work on Tuesday, because my job was actually closed. Not closed, but as you guys know, I just got a promotion, so I got a team. I have a team of guys that I'll be running, but they don't start yet until the 11th. So I got a little bit of time before they started. So since I didn't have a team, I was able to take off this week, and I don't actually go back until the 5th, which is Tuesday. So I should be fine, good to go for work. Kids will be out of school, so I don't see any real problems. I won't have to worry about driving anywhere. So the first day I really have to go anywhere won't be until Thursday of next week when I go for my follow-up doctor's appointment. But I think everything should be good to go for there. I'm just going to keep rinsing out my nose and going from there. Yeah. I might try the cool mist humidifier tonight to see if that kind of helps. Because sometimes it feels weird, like too much air is going through. And it's kind of like if you ever stepped outside in the cold and you took that deep breath and you just feel a hit. It kind of feels like that, but it's coming along, so it's alright. Alright, what's up, people? It is day 4. It is Sunday. I had the surgery Wednesday. I am no longer taking any pain medicine, so I haven't taken it since yesterday afternoon. I don't feel any pain, I'm just congested. If you really had a really bad cold before, you understand what it feels like. It's not too bad. It's just annoying, more so than anything else, because you can't blow your nose. You can't really get a good suction in there and then spit out. You know, I've been doing a little bit as much as I can. Saline spray, I've been using it like water. Like, I'll tell you right now, it'll tell you to get a pack. I'll tell you to get a saline spray. go ahead and clear the shelf. I use pretty much 1 can a day. So I had to go buy more because I started off with just 1 can thinking that was gonna be enough. But nah. These things right here, I'm definitely going through a can a day. So I even bought one that's a little bit bigger. But yeah, that's gonna be your best friend because you can't do anything to blow your nose or anything like that. So that's the only way you can really rinse it out. I do that, I let it drain out, put a little bacitration on the inside so it doesn't get too dry. It's not too bad though. It's just the congestion now at this point, which honestly, I would rather pain that I could take pain medicine for than the congestion. But it is what it is. As I'm using the Q-tip in my nose with the bacitration, I'm starting to see less and less stuff, blood come off on it, which is good, I guess. I don't have any stitches in it. They're all dissolvable, so I'm pretty sure sooner or later I'll probably start seeing those fall out. But yeah, it's just trying to get back into a swing of things. I don't go back to work until Tuesday, but I don't like I feel weird just sitting down. Like I got stuff I feel like I gotta do, and I just don't like being a burden. So I'm gonna try to walk around today, get my legs flowing, and go from there. But kind of keep you guys posted and let you guys know how it goes. But yeah, day 4, so far so good. Definitely get yourself a cool mist humidifier, because that's what I did last night. I just had it blowing on me because I was really congested yesterday, like really bad. So it's not as bad today, but I think it's because I pretty much had the humidifier blowing in my face all night. So I guess that helped it out a lot. I'm no longer using the Afrin. I'm just trying to see if I could just do it without it and go from there. But let's keep this going, people. Alright, what's up, people? It's another day. It is day, say 5? I believe it's day 5. Got a haircut now. I feel like a new bed. Still a little congested. Not too bad. I could technically breathe through both my nose throughout most of the day. I don't even have to have the thing under my nose. Even when I rinse, there's nothing too much really coming out. I do still feel stuff further up. Like further up here in my sinuses. Like if I take my finger and press right under my eye, I could feel like a little bit of pressure. Not pain, but just like there's something there. And it kind of makes like a tingling feeling further down, like there's stuff in there. So when I go to the doctor on Thursday, I guess he's going to flush all that out. I actually bought another rinse that should get a little better than the saline spray that has a little bit more force, but I'm a little afraid to do it, so I'm going to wait another day just to make sure things are healing up pretty good. But there's no real blood coming out. I'm still using the bacitration or the Q-tip to rub inside my nose, and it does help keep it nice and moist just to make sure there's no scabbing. But before, there was always blood and stuff coming off. Now it's barely a little bit of stuff that's coming off on it. So it's good. Yet last night made the biggest change for me. So like when I recorded the video yesterday was in the afternoon. By that night, I had probably rinsed my nose maybe 7 or 8 times. And by the time I got out the shower, sat down on the couch, I actually had relief from the congestion to where it wasn't just like feeling like I was stuffy where I had to go to suck in. It was just kind of okay. You know, I had the cool mist humidifier going just to be on the safe side, because after you do the rinse, it is a weird feeling. It's kind of like you kind of cleaned everything out and now there's a lot of stuff like air coming in at a time, and it kind of irritates a little bit. Not irritates, but kind of like, I guess the easiest I could call it is if you go outside when it's really cold and you take that first deep breath in and it hits you and it's just like, whoo! So it does feel like that. I do feel that there might be some type of scabbing on the inside on this side. So I've just been using the bacitration as much as I possibly can to kind of keep it nice and moist in there, and then flushing it out. So I'm still flushing it out every couple hours just to make sure. But yeah, it's not too bad. I've been off the pain meds for the past, what, two and a half days now. So I can't really complain. I've been out and about today. I went to Home Depot. I patched a hole in the wall. Tomorrow I go back to work. I got a haircut. It's not too bad. I'm all right. So I would definitely do it again if I had to. as long as this works, you know, obviously it's going to take, I think from reading online, the doctor's going to clear everything out on Thursday. So that'll be 7 days, get everything cleared out. And then from there, it'll still take another couple weeks for all the swelling from the surgery to go down. As well as when he reduced my, when he did the Tubinate reduction, people say it does scar a little bit from that, from the way they, like, I guess the radio frequencies and stuff like that, just like a little scar tissue. So I'm probably still going to have to keep flushing to kind of rinse it out as best as possible. And until that completely goes away, I'll probably still feel a little bit of stuffiness. It's not really like congestion, like, oh my God, it's not that anymore. Like, I still feel on this side a little bit. You know, it kind of goes, but it more so feels like there might just be something stuck a little further up the nose that you won't be able to get to unless you actually either blow your nose or like you use like a Q-tip or something, get in there to try to clear it out or rinse it out hard. But I'll see what happens tomorrow when I actually do the, I might actually do it tonight, man. I'll try to just do the full rinse. It's a little tube thing you put in and it's supposed to push up one nose out the other. We'll see how it works, I don't know. And then otherwise of that, it's been pretty straightforward, you know, it's not that bad. I would, like I said, I would definitely do it again. If you are thinking about doing it, definitely talk to your doctor first. Find out what your surgeon's plan of attack is. I think that what really helped my recovery process is the fact that I didn't have any packing in there. I also didn't have any nasal splints, so I didn't have to go back within 3 days to get that taken out. So when you have that, that's literally like a plastic tube that goes in there with little wings, and it literally keeps your nose clogged up and open, so it has a little bit of drainage, but it's pretty much like you feel the pressure in there all the time from what I've heard. So I don't have that, which then you pull it out and you got the raw skin on the side. It's just an uncomfortable experience. You hear the kids playing, sorry. They got their first, they got my old Xbox and they're playing Paw Patrol. But yeah, it's not that bad. So I'll definitely see what your line of attack is. Obviously, if you have a lot more reconstruction in your nose, then you probably might not be able to get away without having the packing and the nasal splints. But when he went in, he said that's the plan, is not to use it, but he won't find out until he actually gets in there to find out if it's really possible or not. So he wasn't able to do it. He was able to avoid using them. So it all worked out well in that aspect. Like I said, if I had to do it again, I would. That first couple days, like day 2, 3, the congestion sucked. Like, it sucked. Like, at that point, I would have rather pain rather than the stuffiness. But if you've been dealing with congestion and sinus infections a lot and just always having that pressure, then it's not going to be something where you're going to be like, oh my God, this is brand new. Like, I've never had that experience. I just always felt like there was something back there that wasn't back there before. So, and now it's from those Tubinate things being enlarged. I'm not even saying it right. I don't know. But yeah, it's been pretty straightforward. I'm still taking the antibiotics. Still moisturizing with the vasodilation on the Q-tip. Still using the saline spray. Yesterday I rinsed like 8 times. So that is going to be the key in order to get that faster recovery. Is definitely make sure you're rinsing out all that stuff as much as possible. Yeah, and I just took like a tissue and I just kind of like was taking out some of the mucus that was kind of stringier. And as I did that, it got easier and easier. But yeah, I'll keep it going and I'll keep recording until I actually go to my follow-up appointment and I get the clear okay from the doctor. But so far, I think we're good. Now, if this just resolves all my breathing issues, then I'll be all right. All right, well, today is day, what is it, day 8, I guess? Yeah, day 8. I didn't do a record yesterday because I was actually pretty decent yesterday. Only thing that happened that changed was I was drying up pretty well, but then like last night for some reason I started actually leaking new blood. I don't know if it was new because it's dark red. Okay, what a creep. But yeah, I'm here for the doctor's appointment. I got my surgery last Wednesday. Today is Thursday. So ideally he's supposed to clean things up. I could feel like scabbing in this side, so we'll see how that all works out. But yeah, I'll keep you guys updated. You ready? All right, let's do this. All right, so I'm just waiting. He just sprayed some stuff in my nose in order to kind of like, I guess, numb my nose a little bit. He says a little scabbing on this side. I kind of feel it. It's kind of feel like a booger's in there type deal, but I'm gonna clean it out and then we'll see if it's going from there. All right, so just left the doctor's office just now. They cleaned out my nose. I could definitely feel a lot better breathing through both of them. This side was a little congested this morning, but he got that one cleared out. Got to come back in 2 weeks from now. I told him, like, man, when I was breathing, I felt like I was hitting air in places I never hit air before a couple days ago. He's like, yeah, it's pretty much, it's clearing out pretty well. So he told me I have to keep doing the antibiotics in my nose, pretty much Bacitracin, Neosporin, 2 times a day. Nice good glop on both sides, so it has a chance to keep it from scabbing, because I did have scabbing and he took it out. And honestly, it didn't really hurt. You just feel like somebody, it's like if somebody was going to put a Q-tip in your ear type stuff. But I mean, so far so good. I can officially sleep with my head laying down. My dissolvable stitches are still in there. He said they have to stay in there for a little while, so that's good. And I come back in 2 weeks, see what it's talking about. Can't exercise or anything just yet. He said give him another week or 2 at least. When we do our check-in, he'll kind of go over to see, bless you, see how we're looking. But he's like, as time goes by, just keep on doing the Bacitration for the next 2 weeks. For the next month still, I'm still going to do the saline rinses to kind of keep things all rinsed out and flush. He said that he spent a lot of time making sure that I did reduce as much of the Turbinate as possible. So he said the congestion is probably going to last a little longer. But so far so good. Can't complain. But that's it. If you have any questions, let me know. I'll probably do another video in probably another couple weeks to let you guys know how I feel. But this is more so just so you guys can have a general idea what to expect. Like I said, everybody's thing's gonna be a little different. Only thing I can say is if you could do a research, find a doctor that's probably not going to use any nasal packing and nasal splints, make your life a whole lot easier. Because to be honest with you, I didn't feel any pain really. More so just irritation from like having extra air come in a couple days after. I had still put the gauze on my nose, not really to stop drainage, but more so just to prevent all the air that was coming in at one point in time. So it was good. I can't complain. I would definitely do it again if I had to, but so far I'll let you know if it's worth it in a couple weeks.